AJ, tell us a little bit about your career because uh, you work for a tribal network of clinics, and I kind of recall that uh, half of them didn't have roads into them,
That's right.
and and you were trying to figure out how to get quality into all of these remote uh, small clinics. So anyway, tell us about your career. How did you get to where you are?
Yeah, I did. I joined a tribal health organization a couple years after I retired from sport and started essentially as a care coordinator, appointment scheduler. So I did not have a big fancy job, and working for a tribal diabetes program. So I did get to know the diabetes world a lot and really enjoyed working with those patients. So our region covered an area that is the same size as the state of Texas. So very small villages distributed across a huge geographical area, most of them on the rivers. So half, as Jim said, half of those clinics were off the road system. So you most of the time had to fly. Sometimes you could snow machine. Sometimes you had to do a combination of both, and sometimes you went by boat. So it was pretty exciting to be able to do that. And most of those villages were staffed by essentially like paramedic level community people who were not trained physicians or PAs. And so they were delivering care to their neighbors, to their family. And so the idea of quality and metrics and quality improvement was a little bit of a tough sell because it was very neighborly communal healthcare. And so it was a challenge, but we got through multiple quality improvement projects, got all of our village health clinics accredited, and was just a very exciting project. And I built relationships that I still cherish to this day through that.
Well, thanks to AJ. Yeah, a pretty interesting Melissa we got here. She just completed a TED Talk, which is quite a credit to anybody. She and her husband Dan own a beer brewery in there in Boise. So she's a fun person to get off to the side and talk to. She is very involved in Medvel. I'm happy to say. So, for example, she was on our Denver Block Party Committee. She's a member of our town council, of our new Advisors Bureau. It is the president of one of our Medville clubs, the Transformers Club, and is therefore a member of our club president's club. I was thinking about this morning, AJ, when I saw email coming in from late last night. She speaks and she writes with lots of exclamation points, and I like that. You'll kind of get that idea about how enthusiastic AJ is. So, AJ, tell us a little bit about Desert Sage. This is an interesting place too, in Mountain Home, Idaho, where there's lots of desert and lots of sage. So, tell us where your career has taken you, and pretty soon you're going to move up from the COO to the interim CEO. So congratulations. So tell us about Desert Sage.
Yes, so Desert Sage is a federally qualified health center. And if you're not familiar with that, essentially we are part of a government federally supported grant program. It's actually one of the very few bipartisan supported elements of our federal grant system. So we have support from both sides of the aisle, partially because it's cost effective and partially because it takes care of anyone, regardless of their ability to pay. So Maria, who's on the call, actually works for one of our sister health centers in Boise. She and I are part of the same health center network in Idaho and throughout the country. And our goal is to do just that. It's to provide care for all patients in the community, regardless of their ability to pay. And then it's also to provide full services and integrated behavioral health, dental health, and medical care all under one roof. And it really is a mission-driven organization. We are an independent nonprofit, so we are not a government agency. We just accept some government dollars to help support those patients who can't pay for their own care. But it really, this type of health center attracts and draws people who really care about taking care of their neighbors and doing so in a really compassionate, high quality way, so that it doesn't matter if you go here or you go to a big fancy healthcare system or a private practice. We can provide the same level and quality of care as any other organization out there, and sometimes with better outcomes as well.
Well, I think our audience knows one of the titles we've used is drive-through coffee. Why not drive-through healthcare? So this is going to be a lot about innovation, but maybe more importantly, how that innovation happens and what AJ has done to foster that team spirit, the group think that goes into this. So when she and I were uh, thinking about this particular Elysium, I said, well, so the drive-through clinic, whose idea was that? And I was so fascinated by her response is she didn't know. So uh, tell us about that. And we've got some pictures to show.
I think, like all of us, during COVID, we had to learn to do things differently. It doesn't matter what profession we were in, or whether or not we were even working in a profession at all. But we were really challenged because we had patients suddenly who did not want to come into the building. And we knew that we could not survive if we could not take care of patients. And it wasn't good for our community either, because other organizations in the community were dramatically decreasing services, sometimes closing their doors for unknown amounts of time. And so as we were huddling just a couple days after the first case hit Idaho, we were just talking about how can we do things differently so patients feel safe and they're not afraid to come in the building. They can get the care that they need. And as Jim said, I don't even know if it was one person's idea or if it was just catch ball that built on itself, but we came up with this idea of delivering sick care in people's vehicles. And so we sat down and thought, okay, how could we make that happen? We had a person who was great at getting community resources together. So we essentially leased the parking lot in the building next door to us. We had a big tent from a tent rental company. We took some plastic tables and folding chairs out, put some chalk marks in the parking lot for parking spaces. And in 4 days, we designed an entire service line around delivering sick care to people in their vehicles. And so that started in March. Those of you who have been to Idaho, you know that March, April, and even May sometimes can be really unpredictable. So we had a whole service line, and that service line supported over 30% of our medical visits during the time that we were operating out there. And people loved it. They felt much safer. They felt, I think, not going into an enclosed space felt much safer to them. Their car felt like a safe space to them. And it certainly wasn't perfect. We knew that after 4 days of design and practicing and literally using our hands to practice driving into what would be our car clinic in the conference room. But we said, we've got to launch this or we're never going to do it. It doesn't have to be perfect. It has to get people through the door. So that ended up being what allowed us to keep everybody employed, because it took an entire team of people essentially to run this car clinic. We even had one of our dentists out as a greeting people for a couple days, because we wanted to keep everybody on the clock and employed and not have to do any layoffs or furloughs during that time. And the dental team supported us so much in that, because they took the hardest hit with COVID precautions. So it really was about just supporting the team. I did not lead the team through any of this design. I supported from the sidelines. I was in the room with them, but my job was to get resources and let them do what they do best, which was figuring out how to register patients, how to take care of patients, how to organize testing supplies, how to run traffic flows. And in 4 days, we created something that hadn't existed before out of a tent. And today you can see the permanent version of that. It's something that people love so much. We built it and designed it into our new building, which I'm sitting in today and has been open for exactly 90 days at this point. So pretty exciting stuff. This is looking from the back of the car clinic to the front. So you can see here there are two bays. If you look in kind of the center top of that picture, you'll see a second garage door there. And so this system allows us to open the garage door, the patient drives in. They have typically a regular acute visit where they might be getting tested for flu or strep or something like that. But if the provider decides that that patient needs a physical exam and needs to be pulled out of the vehicle, there's a door there in the just to the left of center in that picture, and there's a full exam room in there with doors open to both sides, so both bays can use that exam room. So if something a little complicated or different comes in, they have the ability to have all those clinical tools right there where they need them. So currently we have one bay that's appointments, so people get regularly scheduled times. And then our second bay, we're doing no appointment necessary. Anyone can drive up at any time and they may have to wait, but they can get care same day.
So, in the midst of this COVID crisis, I think you were asking a question like, if we couldn't have a waiting room for chronic patients, what would we do?
Right.
And I like what you've said to me before is good answers require good questions. So tell us about some of that group thinking you were going through and how you were asking each other hard questions that led to some pretty good answers, it looks like.
Yeah. I believe my role in innovation is really to ask the hard questions and then let other people who have the knowledge of the specific workflows be creative and design what they think is best. So the question about the waiting room came from a little bit different process improvement that we were working on. We were coming up with a pager device like you have in restaurants, where if you have to wait, you get a little device, you can walk out to the parking lot and it will buzz you when it's your time to get a table. So we didn't want patients who were coming in for important chronic care visits piling up in the waiting room and potentially making one another sick during that time. So the group was really struggling with this idea because we always had a waiting room and we had chairs and we had a space to allow people to wait. And we were just stuck in some old thinking. And as the person who believes it's her job to ask really difficult or provocative questions, I said, okay, I want you guys to stop thinking about what we're thinking about right now. Forget developing new ideas. And I want you to envision that this afternoon, the CDC walks into our building and says, we are shutting down all waiting rooms in all medical facilities indefinitely. You may no longer use waiting rooms. How are we going to check in patients and then allow them to wait for visits and notify them when their provider's ready? And something about just creating a scenario and asking the question in a little different way, it unlocked the thinking. And that's where the team came up with the idea for the pagers and a notification system and a digital intake system where people could check in online. So I don't have the good ideas. I don't have enough good information, and I don't know the workflows well enough to have all the creative ideas.
But you got good questions though.
I got good questions. That's that's my gift, thankfully. So and I think our team at this point is used to having hard questions pitched at them because they know that ultimately it leads to them coming up with their best ideas. You know, I don't take credit for those. I just keep prodding, and I tell them I always reserve the right to ask questions.
Well, tell us a little bit more about the group processes that you uh, seem to be very proud of. Uh, how how did you do that? How did you get people engaged? Maybe the feeling of ownership that you've engendered, and you used a couple of Medvalistas too to come through your facility and make recommendations. I know you're a big fan of lean,
We are.
so what? How do you do that, AJ?
Yes, we started going through a lean transformation at Desert Sage just as I came in. So it's probably been at least 6 years, and started small, just kind of learning about how to improve workflows. And then we really came to understand that lean is more about a culture. And the two primary values that lean is built on is respect for people and their knowledge and their skills and gifts, and then continuous improvement, which means we're never done improving and we're never comfortable with the status quo. So, but lean also has a structure that can help with creative thinking and respecting people's input. So as we went through our lean transformation with an outside agency and then with help from Mohammed and Paul, who are both Medballistas, we've grown this system where people use a structured thinking method, which starts with, why do we need to solve this problem anyway? And then it really digs into, what does our future state look like? How will we know when we get there? What are the obstacles between where we are today and where we want to be? What are the root causes for those obstacles? And then what could we test to overcome those? And then looking at where our tests successful. So that has become the way of problem solving and innovation at Desert Sage, because we've gone through it over and over and over again. And it's really become part of the fabric of who we are and how we do things. So innovation is happening every day at every level of the organization. Sometimes, most of the time, really tiny innovations. You know, they're not necessarily huge projects like this drive-through clinic, but they can be just little improvements in the ways that we do things that we hadn't thought about before. And I think the other key component that was probably the hardest to drive home was, it's okay to fail and it's okay to test. As long as we're being safe and as long as we're being ethical, it's okay to test anything out, because we won't know if we don't try it, and we expect to fail the first time around. It's one of our mantras around here. Let's plan to fail, and then we learn as we go.
Well, how have you evolved to that state? Uh, did your people naturally feel this way, or do they self-select in because they like that environment? Or
Mm.
did you get a pretty random bunch of employees and socialize them to think that way?
Right, right. I would say we started with a core group who we knew could adopt the principles. So we had a group where we were all learning the process together. And then over time, we started bringing in others to help learn that process and grow with us. And at this point, it's actually part of our culture code. It's one of our core values. Our 5 core values is continuous improvement. And that's in our performance reviews every year. So participating in continuous improvement is not an option at our organization. People can't opt out. They can't say, that doesn't include me. I don't want to do that. It's part of how we do business, and it's an expectation now. But it's really about the true adoption is really about when those people bring ideas and they take a chance and they're vulnerable and they bring something forward. Do we take it seriously and do we act on it? Because that's where you build trust and credibility, and people's desire to share their best ideas is when you actually do something with them and show respect for the fact that they brought it forward. Doesn't mean it's going to work every time, but you still have to at least give credit to the fact that they brought an idea forward.
How do you personally engender that to create that safe environment?
Hmm. The the behavior that we had to stop doing was troubleshooting ideas as soon as people brought them up.
Mm,
So as probably all of us are, we're fixers. We like to fix problems, but there's also a lot of banter that comes with figuring out how to solve something correctly or in the best way for an organization. So it used to be that we'd have ideas, but we'd try to troubleshoot them instantly and figure out why
mm,
they may or may not work. So what we've had to do as an organization and as a leadership team is to say, let's think about that. Let's ask some more questions. Let's figure out how we could make that work. And sometimes the answer is that won't work. But by avoiding that shooting down of ideas early on and just giving it a chance to sit and entertaining what that idea means, I think that's the most important thing for a safe environment around continuous improvement.
mhm. So, how did, well, I think we know, but you want to give uh, a little bit more information about how COVID-19 improved Desert Sage? Because I
Sure,
think you're saying that it did.
it did.
And so weren't you lucky to have a pandemic?
We were lucky in a lot of ways. Never waste a crisis, I think is is advice I've heard from a lot of people. And we certainly didn't do that. But yeah, the car clinic innovation, I think, was it was good for us in a lot of ways. One was that we got some press for it, which, we don't necessarily go looking for that as a community health center. We have kind of a quiet presence in the community. We do our thing. We're respectful of our partners, but we did get some attention for what we were doing. We attracted a lot of new patients during that time because no one else was offering a service like this, especially in this area. It supported all of our staff members during that time. We had minimal furloughs, and we actually grew our medical service line because people came. They had this very efficient experience with amazing staff members, and then they became our patients. So we came out much better from COVID. And then we took what we learned from the development of the car clinic and parlayed that into high volume for us COVID vaccine clinics, and became super efficient about getting those things done. And we had people driving from 3 or 4 hours away when COVID vaccines were very hard to get because they could get in to see us. They could do it very efficiently. There were no lines around the block, people waiting for hours to get those. So we presented ourselves in a very humble way, but in a very efficient way that built trust with people who didn't have any experience with us before.
Tell us about putting the signs out on the road. Didn't you put a sign on the road that said appointments available? And so you had people, you got quite a bit of traffic that wasn't scheduled
Yes.
too. So can you tell us how you dealt with that?
Yeah, that's actually been a very recent, that we actually just started that about 3 weeks ago. So we moved into our new building February 19th, and we were closed down for 3 business days to make that move. And we opened up the new building, and we just had some low volumes that we weren't expecting after we went back to full schedules about 2 weeks later. And so we thought, okay, how are we going to help people understand how to get appointments with us, how to utilize the car clinic, what it's used for, because our volumes were much lower than we expected. We just weren't seeing a lot of sick people in general. And we weren't sure if it was, just flu season wrapping up, or the fact that we moved, or all of those things. Medicaid disenrollment in Idaho has been a factor lately. And so we were really struggling and said, man, I hope we didn't build this thing and no one is now coming. So we have a big digital reader board out on the road, and we put in open 8 to 4, car clinic, no appointments necessary. And then we started seeing the traffic. I think one of our physician assistants had 16 visits last week, most of which were unscheduled. So it may be that we can't do that forever. If we start filling up our clinic with unscheduled appointments, we may have to go back to appointments needed. But in the interim, our goal was really to get people comfortable with how the process worked, because it was new. It was essentially a new way to get care, because there's garage doors and stoplights and things like that. But we really wanted to introduce the community to this new space and how they could get that acute care. And appointments appeared to be a barrier. So we took that barrier out of the way. And if we have to put it back up just to control volumes, we'll do that. But that would be a good problem to have.
Yeah. Well, and when we open it up for the discussion part here pretty soon, I think you wanted to maybe pose the question to your Medvelisa friends that a problem you have is the car people may not be established as a patient,
Right.
and what are you going to do with that? So we'll open that up pretty soon. But what's been the response to the car clinic? I know you may be going from the term car clinic to drive-through, but how do people feel about that? Are you stuck with having to do that forever now because it's been accepted?
Well, it takes up a lot of square footage in our new building, so I think we're stuck
Yeah,
with it at this point.
yeah, yeah. Uh-huh.
No, you know what we were worried most about actually was staff, because in our old building, when we transferred from the parking lot and then continued care in our old building, people had to go in and out all day, and we do this year round. So there were times when it was 100 degrees outside. Thankfully, that's the shady side of the building at 3 p.m. But it's, it's still 100 degrees out there, and people in their cars sometimes can get uncomfortable when it's that hot. And then similarly in the winter, we're offering that care when there's freezing rain and snow. And so we're really worried about the staff not wanting to work in that environment. But we have a few team members who love the outdoors. They love to be active and moving. They like doing something a little different. A lot of times those visits are quick, easy visits. So it can be a break for them if they have a panel of chronic patients and they need an easy day. So we definitely have some medical providers who just really love that environment. And now that we have it built into our facility, we have some more temperature control. We have a cover over their head. We have an office where they can warm up or cool off. And it's just, it's a much better setup for them as far as a long-term sustainable service line. Most people who get care in Car Clinic, we have rave reviews from our patient feedback system. It's so great, especially for, moms with a car with 2 or 3 or sometimes 4 sick kids in there. They don't have to unload the kids, unload the baby, get everybody inside, bring the diaper bag. Everything is right there for them. And then for our elderly patients who have mobility issues, if they're coming in for a sick visit, they don't have to get out of their car and try to walk all the way to the front door. They can just stay in their vehicle and get care. And those are the 2 groups that have really received that well.
Mhm. You've got 3 nurses here on the call. AJ, uh, how much care can you provide in a clinic?
Yeah, we're actually talking about that right now. Primarily, we do sick care. So we don't do what you might consider urgent care, where someone could come in with a broken bone and get casted, and we just don't have the supplies for that. So it really is ear infections, strep throat, flu, colds, allergies, things like that, UTIs. But we're talking about doing vaccine clinics through that route. We're talking about sports physicals because those are relatively quick. Usually those patients are pretty mobile. They can get out of a car and have an exam. And then we're also talking about whether or not we could do Medicare annual wellness visits through that service line. So there's all kinds of possibilities. Some may work, some may not, but we have a lot of opportunity to test and see what patients are responsive to.
Yeah. Well, good. AJ, any kind of closing remarks uh, before we grab another cup of coffee and sit around and talk about innovation, team approaches to this? Any summary that you want to offer before we move on?
Yes, I would leave you with innovation is really about just trusting your team members. We could not have innovated not just the big things, but also the small things without the belief that the people who do the work are the experts. And I don't have to own that. I don't have the ego or need to take credit for their ideas. What I can take credit for is trying to foster a culture where it's safe for people to say, this isn't working. I have something different I'd like to try. And innovation is really that simple because people are creative and they want to share their best ideas, but you have to build the culture and the environment where it's okay for them to share those things. You don't have to go through a lean transformation process to put those things into place. It's really just about leadership.